Welcome to the debate. Right now, in education, there is this massive silent crisis.
Yeah, 1 in 5.
Exactly. 1 in 5 students is experiencing a mental health condition. But, the vast majority of them just never get any help. I mean, think about it like this. If 1 in 5 kids were injured by, say, a burst water pipe in a school hallway, the disruption would be immediate.
Oh, absolutely. It would be chaos.
Right? The water's everywhere. Administration acts instantly. You locate the broken valve, shut it off, fix it. But because this crisis is invisible, the structural damage just kind of compounds quietly over time.
Well, and the urgency just isn't self-evident in that same physical way. A failing grade or a sudden behavioral shift, it doesn't trigger the same administrative alarm bells as a flooded cafeteria.
Exactly. So today we are analyzing a modern response to this very crisis, which is MentalSpace School. It's a K-12 mental health support system currently rolling out across Georgia's schools.
Right, and it aims to really close that massive gap.
Yeah, between the staggering 1 in 5 need and the actual delivery of care. And they do this by providing secure, confidential video sessions to remove stigma, same-day teletherapy, and comprehensive school support.
Which brings us to the central question we are exploring today. When we look at this enormous chasm between a student in need and a successful intervention, how do we actually bridge it? Like, what drives the effectiveness of a program like this?
Right.
Is the solution fundamentally a logistical one, focused on removing physical and bureaucratic barriers through sheer speed and technology? Or is it fundamentally an ecological one, focused on embedding culturally competent, comprehensive care deeply into the school community itself?
Well, I argue that dismantling the logistical friction through same-day teletherapy, zero waiting list, and widespread insurance compliance is the definitive breakthrough. I mean, the logistics are the actual mechanism that bridges the access gap.
And my position is that rapid access is essentially meaningless without systemic depth. I contend that the true transformative power lies in MentalSpace's ecological integration. Things like dedicated therapist teams per school, family counseling, and staff wellness.
Let's start with the immediate reality of that 1 in 5 student. The mental health crisis in our schools is at its absolute core an access bottleneck.
Okay.
It is a failure of logistics. Think about the traditional model for a moment. A student is identified as needing help. A referral is made by a school counselor, and then
The waiting begins.
exactly, the waiting begins. Parents have to find an in-network provider, which is a massive hurdle on its own. Then they have to, schedule an appointment during working hours, physically pull the kid out of school, drive across town, sit in a waiting room, and drive back. The friction is immense.
It is a profound burden on the family. Certainly. I agree with that.
It's a paralyzing burden. And MentalSpace School introduces a radically immediate model to bypass it entirely. A student can access a licensed therapist the exact same day they are referred, directly through secure video.
Right.
Is what actually gets that student through the virtual door.
I absolutely acknowledge the value of speed in a crisis, and I'm not denying that the traditional system is broken. But we cannot mistake a fast connection for a deep solution.
How so?
Well, mere tele-access, simply dropping a screen in front of a child, cannot solve complex, deeply rooted K-12 crises.
But it's not just dropping a screen, it's providing immediate professional care.
I mean, I come at it from a slightly different way. Let me explain how I see it. Dropping a random telehealth therapist into a school environment is, it's like plugging a foreign USB drive into a complex, specialized network.
Okay, interesting analogy.
If that therapist doesn't speak the local operating language, the culture, the recent local traumas, the socioeconomic realities of that specific zip code, the system rejects the intervention.
Right, but
Let me just finish this thought. When we look closely at the MentalSpace model, the evidence points to a much deeper mechanism at play. They don't just offer any random therapist available on a server. They offer dedicated therapist teams per school. They prioritize licensed, diverse therapists who are culturally competent.
I completely agree that cultural competence is important, but
It's not just important, it's the active ingredient. Healing a child's mind isn't like ordering food delivery on an app. It requires a rooted relationship within the school ecosystem.
yeah, but
If the therapist on the other side of that screen doesn't understand the specific social dynamics of that student's community, the speed of the connection is irrelevant. The transaction doesn't heal, the relationship does.
See, I'm not convinced by that line of reasoning because, frankly, context requires a living patient.
Oh, wow.
No, seriously. The reason we call this a silent crisis is precisely because of the systemic delays built into the traditional model. When a student gathers the courage to finally say, I am not okay, or a teacher notices a drastic shift in behavior, there is a very narrow window of opportunity to intervene.
That's true.
If that window is met with a 3-month waiting list, the student falls silent again. They internalize that help is unavailable.
But how does a rapid response meaningfully address something like a severe depressive episode or a risk of violence?
Because the same-day Tele-Therapy acts as the tourniquet. If a student is in crisis, a 3-week wait list is like telling a bleeding patient to come back next month. Without that immediate logistical capability, your dedicated context doesn't matter because the student is lost to the wait list.
I see what you're saying, but
You can have the most culturally competent, deeply integrated therapist in the world, but if the bureaucratic barriers prevent the student from seeing them for 6 weeks, that expertise is completely useless to the teenager who is contemplating self-harm today. The speed is the absolute prerequisite for the care.
a tourniquet stops the bleeding, yes, but it doesn't heal the wound. And if left on too long without comprehensive surgical care, it causes irreversible damage.
Fair point.
A rapid response is only effective if the person responding actually knows what they're responding to. A dedicated team means that even though the therapist is remote, they are consistently assigned to that specific school. They learn the culture.
Right? They know if the school recently experienced a local tragedy. They build a rapport with the principal and the guidance counselors. When we are talking about high-stakes interventions, specifically the suicide and violence prevention that MentalSpace handles, context is literally a matter of life and death.
I hear you. A random triage therapist answering a video call within 5 minutes might not recognize a localized warning sign that a dedicated therapist would catch instantly.
Wait, let me clarify how the logistics actually protect that process, because you're painting a picture of a loose, disorganized video call, and that's not what this is.
Okay.
MentalSpace engineers this point of entry meticulously. We are talking about HIPAA and FERPA compliance right on campus.
Right, the regulatory alphabet soup. But how does that actually change the student's experience in the room?
It changes everything about the viability of the program. HIPAA is the federal law protecting medical privacy, and FERPA protects a student's educational records. Usually, mixing a medical intervention with a school environment is a legal nightmare that terrifies administrators.
That is very true.
Right? So MentalSpace handles all of that compliance. Practically speaking, this means a student walks into a designated, legally firewalled, secure room, often in a nurse's office or counseling center. They aren't just sitting in the hallway on an iPad, hoping nobody overhears them. They step into a confidential space, have their session, and step right back into class.
Which leads us to the outcomes, because we have to look at what actually happens once they are inside that firewalled room. The metrics provided for MentalSpace School are staggering. We are talking about 89% improved attendance and 92% reduced anxiety.
Exactly. And those metrics are a direct, unassailable result of the logistical model we are discussing. Why does attendance improve by 89%? Because the friction of leaving campus has been engineered out of the equation.
Wait, you think attendance improves just because they don't have to drive across town?
I think attendance improves because the psychological toll of leaving school is massive. In the past, a therapy appointment meant missing half a day of instruction. The student misses their AP math lecture, which creates intense academic anxiety, which then exacerbates the very mental health condition they are seeking treatment for.
Sure, the missed class time is stressful. Furthermore, they carry the social stigma of being the kid who walks out the front doors every Tuesday at 11 a.m. while their peers are heading to lunch. The 92% reduction in anxiety is heavily tied to the fact that they don't have to fall behind academically or socially just to get health care. The logistics solve the anxiety loop.
I'm sorry, but I just don't buy that. Let me tell you why.
Go ahead.
A screen alone, no matter how seamlessly it fits into a bell schedule, does not fix systemic attendance issues. A student who is chronically absent because of severe depression or an unstable home environment isn't suddenly coming to school 5 days a week just because they get to use a secure iPad in the nurse's office without missing geometry.
Well,
You are completely ignoring the third metric in the data, which is 85% family satisfaction. I'm not ignoring it. I just view it as a secondary benefit.
It is the primary driver. The success metrics, the attendance, and the anxiety reduction are driven by the wraparound services. MentalSpace specifically provides family counseling and crisis intervention. They aren't just treating an isolated child in a vacuum, they are treating the family unit.
But how does a K-12 telehealth service practically treat the family?
Because the dedicated therapist doesn't just clock out after speaking to the student at 10 a.m. They are coordinating virtual family sessions in the evenings with the parents. They are working with the guardians to stabilize the home environment.
Right.
When culturally competent therapists work with the parents, often in their native language, to create a supportive structure at home, that is when the anxiety drops. That is when the child feels safe enough to attend school regularly. The ecosystem heals the student, not the logistics of the video call.
That's an interesting point, though. I would frame it differently. I absolutely do not deny the profound impact of family counseling. But ask yourself how those families are getting into counseling in the first place.
Through the school's referral.
Yes, but traditionally, a referral is just a piece of paper that gets lost in the shuffle. These are often families who are working multiple jobs, who are overwhelmed, and who historically have immense distrust of clinical institutions.
That's a fair assessment.
Sometimes due to language barriers, sometimes due to a lack of insurance. If you just call them and say, hey, you need family therapy, they will disengage. Without the secure, frictionless point of contact established during school hours, these families would never engage with the service at all.
So you're saying the student's initial session is a Trojan horse for family care?
Exactly. I'm saying the logistics build the bridge. The student has a successful, frictionless teletherapy session at school. The stigma is broken. The student goes home and says, hey, this actually helped.
I see.
Then the parents are willing to log on for an evening session and engage in the family counseling. The ecological benefits you are praising are magnificent, but they are downstream consequences of the logistical triumph. If you don't nail the logistics of that first same-day appointment, the family never enters the ecosystem.
Downstream, perhaps, but they are the actual mechanism of long-term change. If you just give the student an isolated session and send them back to a chaotic environment, the anxiety will return the very next day.
Right.
The systemic approach is what makes the intervention stick. But this naturally brings us to a much larger question. If these wraparound services are so vital, how does a system like this actually sustain itself across an entire state's infrastructure?
Yes, let's talk about scale, because scaling the solution is where the logistics become absolutely paramount. We have to look at the financial and regulatory friction that usually kills these programs before they even get off the ground.
Yes, the administrative graveyard of good intentions.
Exactly. A district might want to offer family counseling, but they go bankrupt trying to fund it. MentalSpace casts a massive insurance net to solve this. They accept Medicaid at $0 to the student.
That is huge.
Let me repeat that because it is crucial. $0 out of pocket for a Medicaid family. Traditional therapy requires copays, out-of-network fees, deductibles that immediately disqualify low-income families. MentalSpace processes Blue Cross Blue Shield, Cigna, Aetna, United Healthcare, Humana, Peach State, CareSource, and AmeriGroup. They act as a fully integrated clearinghouse.
Can you unpack what acting as a clearinghouse actually means for the school district?
Absolutely. It means the school district doesn't have to hire a team of medical billing specialists to figure out how to charge CareSource versus Peach State. MentalSpace absorbs all of that friction. They handle the messy, complicated routing of claims between the providers and the dozens of different insurance companies.
Right. Furthermore, they provide support for the upcoming HB 268 compliance, which has a strict July 2026 deadline for Georgia schools.
And for our listeners outside of Georgia, HB 268 is a legislative mandate requiring schools to have comprehensive, documented mental health support structures in place.
Right. It's a massive bureaucratic hurdle. This level of financial and legislative frictionlessness is what makes the model viable at scale. District superintendents don't adopt programs just because they have nice ecological philosophies.
They adopt them because they solve the Medicaid billing nightmare. Exactly. They don't cost the district a fortune, and they keep the administration legally compliant with state legislation like HB 268.
That is a compelling argument regarding the adoption of the program. But have you considered that institutional compliance isn't what actually changes a school's culture?
What do you mean?
Well, yes, the clearinghouse mechanics are financially brilliant, and meeting the July 2026 deadline for HB 268 is a necessary administrative reality. But checking a legislative box does not create a healthy school. What makes MentalSpace scale successfully in terms of actual human impact is that they treat the school as a living organism. Let's look at the text. They explicitly provide staff wellness.
Staff wellness is a wonderful addition, but it is a secondary feature to the student care.
I fundamentally disagree. It is the bedrock of the institution. Teachers are experiencing unprecedented levels of burnout, secondary trauma, and utter exhaustion from managing this silent crisis on the front lines.
That's entirely true.
They are acting as de facto social workers while trying to teach algebra. If you only provide therapy to the students, you are ignoring the adults who create the environment those students exist in for 8 hours a day.
So how does MentalSpace address that?
By actively supporting the teachers and administrators alongside the students. They provide the staff with their own avenues for mental health support and wellness check-ins. This holistic, ecological approach is the actual mechanism that creates long-term institutional stability.
Okay.
A school where the teachers are mentally supported, where they have professional guidance on how to de-escalate a crisis, is far better equipped to foster student well-being than a school that simply has a very efficient Medicaid billing department.
I see why you think that, but let me give you a different perspective. While staff wellness is undeniably noble and beneficial, a school simply cannot fundamentally operate these wraparound services without the exact regulatory and diverse financial backbone MentalSpace is built.
Do you think it all comes back to the money?
It comes back to the foundation. Imagine a district trying to implement your ecological dream dedicated diverse teams, evening family integration, robust staff wellness, but they haven't solved the FERPA compliance for the video conferencing or they can't figure out the Medicaid billing. The entire program collapses in a week.
Well, obviously the funding is needed.
Right, so the administration relies entirely on the logistics. The financial architecture is the only reason the culturally competent therapist ever gets to speak to that child or that teacher. The logistics are the foundation of the house, the wellness programs are the furniture.
But a foundation without a house is just an empty slab of concrete. You can have the most beautifully engineered insurance billing system in the state of Georgia, perfectly compliant with every clause of HB 268, but if the therapist doesn't know how to speak to a deeply traumatized 15-year-old in a culturally resonant way, the intervention fails.
I mean, I agree that quality of care matters.
Exactly. The transaction might be recorded, the $0 Medicaid claim might be processed seamlessly by the clearinghouse, but the child remains broken. That is why the ecosystem, the human architecture of MentalSpace, is the primary driver of its success.
Let's summarize where we stand on what makes this model actually work for the 1 in 5 students who desperately need it.
Sounds good.
My position remains that MentalSpace School's genius lies in engineering away the logistical, financial, and stigma-based barriers. By providing same-day access, zero waiting lists, and acting as an insurance clearinghouse to guarantee $0 Medicaid billing through secure on-campus video sessions, it bypasses the traditional roadblocks that have paralyzed school mental health for decades.
Right.
It tackles the crisis through sheer, necessary accessibility. The tourniquet has to be applied immediately, and that requires flawless logistics.
And my position is that true K-12 support cannot be reduced to a highly efficient telehealth transaction. It is the deep, systemic integration, culturally competent, diverse therapists, dedicated school teams, wraparound evening family counseling, and vital staff wellness that ensures rapid access actually translates into profound, lasting healing. The speed gets our attention, but the ecosystem does the work.
I will certainly concede that having diverse, culturally competent care deeply enhances the impact of the therapy once the student is in the room. A culturally resonant connection makes the clinical work infinitely more effective. And the family wraparound services undeniably stabilize the home.
And I will readily concede that without zero wait lists, seamless HIPAA compliance to protect privacy, and incredibly broad insurance coverage that removes the financial burden from low-income families, the best, most culturally competent therapy in the world remains entirely out of reach for the students who need it most.
We remain in a respectful tension over which element is the absolute primary driver. But perhaps that is the exact point. By analyzing MentalSpace School through both the cold, necessary lens of logistical access and the warm, complex lens of systemic integration, we yield a much richer understanding of how to solve this silent crisis in education.
It takes both to move the needle on those metrics. You have to get them through the door, and you have to heal them once they're inside.
For those listening who want to delve deeper into this model's framework and see how these logistical and ecological components actually interlock in practice, I highly suggest visiting MentalSpaceSchool.com or reaching out directly to their team at MentalSpaceSchool@chctherapy.com.
There is a wealth of information there about how they are restructuring this paradigm from the ground up.
We started today by talking about a burst pipe in a school hallway. For a long time, the mental health crisis has been water destroying the foundation in the dark. We couldn't see it, and we didn't have the tools to reach it.
Right.
As we look at the fusion of technology and human empathy we've discussed today, we are finally shining a light on that hidden damage and bringing the right tools to bear. The question of whether it's the sheer speed of the wrench or the deep systemic skill of the plumber that saves the building is one we'll leave to you to ponder.
Until next time.
Thank you for joining us on The Debate.